If you want to stay in the loop, follow us on social media. Our tag is pre-health shadowing. And you can also sign up for our email list and follow us on our TikTok, pre-health shadowing. So since this is an international program, we want to know, where are you Zooming from today? Drop it in the chat. I'm currently calling from California. Awesome. Okay. We also have lots of wonderful opportunities that can benefit you all by being part of our program. If you want to be a bigger part in supporting PHS, we would love to have you join our network of student volunteers and team members. If you can apply to be a part of our administrative team, lead students in various subjects and projects and initiatives with professional outreach, grant writing, and more. We understand that as pre-health students, you may not have the time, so we offer the opportunity to volunteer asynchronously with tasks that can be done in your own time. We would love to have you be part of this program, as well as contribute to your own unique perspective. So these are some of our roles that are currently available. You can go to our website, pre-health shadowing, and fill out the application. And if you're a high school student, you can also join our high school training program, which is offering for leadership and healthcare education for pre-college learner. You can also fill out the application for that using this link over here. And if you are looking to be published, we have a section on our website, which is blog submissions. You can write an article, reflection, reviews, or your success stories, or even more, and send it to us. It'll look great on your resumes, and just a great way to have your creativity and your interests published on our organization. Now, we are a program that is going to be staying free and is accessible to everyone, but we do solely run off of the time and donations of our volunteers. So if you can, we would deeply appreciate if you could donate a little bit to us. This is a QR code right over here. You can also type your questions in the chat, and your co-host will answer them during Q&A. And you want to make sure to take good notes, because our post-shadowing assessment will be available to earn a digital certificate verifying your hours on your professionals course at the page prehealthshadowing.com. So that's going to be after this. You can go ahead and take the quiz in order to get your certificate. And because this is an online experience and it's also meant to be a shadowing experience, we would deeply appreciate if you could turn on your cameras just for a more realistic approach. We know that it's not always possible, but a little face can go a long way. Awesome. So I will now hand it over to Dr. Ramsey.
Hi, everyone. Just give me 1 second to share my slides. Okay. Okay. Hi, everyone. I hope you're all doing well. So today I will be talking to you about a bunch of different things, but basically telling you about who I am, what I do, and why I do it. So really, I hope that after this discussion, you, regardless of if you want to do what I'm doing, which is adolescent health or not, that you come out of this, understanding your why and what it is and what your purpose is for pursuing a health-related career. So I'm going to talk about adolescent health. I'm going to talk about anti-racism. I'm going to talk about activism and advocacy. And then I'll tell you about who I am, where I've been, and where I'm going. So I'm Dr. Natasha Ramsey. My pronouns are she and her. I'm a board certified pediatrician, and I'm also an adolescent medicine fellow and the founder of Gorjus LLC. Gorjus LLC was established in April 2020, which, as you all know, was in the height of the pandemic, and has three goals, which are adolescent and sexual health, anti-racism, and medicine advocacy through art. But this is also me, and I have to be very transparent about who I really am, and the other parts of myself that I'm bringing to this talk as well. I am Caribbean American. My parents are from Jamaica. I currently live in New York, but I'm a Jersey girl, which is Lenape land. I am a product of the public school system, the first in my family to go to college, the first in my family to become a doctor. I am a body positive advocate and a fashionista, so I am all about body positivity. I love to travel, but I'm also very interested in global health. And I'm an adolescent health advocate. At any point, anytime I'm in the room with other people, I'm like, what about the teenagers? What about the young people? And then lastly, I'm a reproductive justice crusader. So any moment and any chance that I get, I incorporate reproductive justice into my presentations and in my discussions related to reproductive health. So you'll see some of that as we move forward. So before I was who I am, I was also this person. It's been a long journey. And I just want you all to know that at some point I was you, and I just kept going. And as a doctor, you're a lifelong learner and educator. So it's important to often give back and use these opportunities to teach people about what it is that you're doing or what you're interested in. So starting with middle school, this is me. Middle school is when I think that my career in adolescent medicine started. I had a health teacher who would tell us to put our hormones in the freezer. And then he would also have us act out the menstrual cycle, and he would basically like hold back nothing and teach us everything that we needed to know about reproductive health. Back then, I was awkward, but everyone around me had all these like cool nicknames like cutie and hottie and whatever, princess, and I was like, okay, I need a nickname. So I came up with Gorjus, which is a play on the word gorgeous, which means splendidly or showingly beautiful or brilliant or magnificent. So that's where the word gorgeous comes from, and I am very proud of that nickname. Then there was high school Tasha. This is me when I was 16. And although I had like really good, education in middle school, can you guys see my screen? Okay, it said that participants can now see your screen as if you guys weren't seeing it before. Okay, let me know if you missed anything. I can go back. So this was me in high school. Like I said, my parents were Jamaican. And so the sex talk was, you're on your period now, you can get pregnant. You can't have a boyfriend until never. And I had a really terrible high school health teacher who just like could not even talk about sex ed at all. Like he was like pronouncing words wrong. He just like would sweat every time he had to like talk about sex. And so at that point, the seed was already planted, and my interest in sexual health was already planted from middle school. In high school, I realized how bad the health education was that we were receiving. And so I joined the Sex Etc. teen magazine and website, which is now, back then was a newsletter, but now is a website and an Instagram and social media account that is dedicated to providing teens with accurate information about their health. And it is run by teens. So it's for teens by teens. So this is a plug for another organization if people are interested, particularly in this area. And I served as a teen editor and a writer, and I created some of the articles and artworks and videos and things. So I just kept chugging along. And when I got to college, I majored in public health, and I participated in a bunch of different programs. And I learned a lot while I was in college. The main things that I learned were you need to identify your why. And when I say identify your why, I mean like legit, write it down on a piece of paper and stick it on your wall. Like, what is it? Why do you want to go into the healthcare field? Why do you want to be a doctor? Why do you want to be a nurse? Whatever it is that you want to be, what is the reason? And write that down, because you're going to hit a lot of obstacles. You're going to have a lot of trials and tribulations, and you have to remember why you're doing it, because otherwise it'll be easy to get deterred or to decide to quit. You have to be creative, try out different techniques, drawing, writing, flashcards, audio, visual, tactile, whatever it takes. right? For those of you who are interested in becoming doctors or any other allied health field for that matter, it is going to be hard. And you're going to be asked to learn a lot of information in short periods of time. So you have to do whatever it takes. I used to study in the shower. I would study while I was walking down the street, on the bus, anywhere. I would be studying at a party, like whatever it took for me to suck in that information, I did it. So, and I've tried many, many different techniques and found what worked for me. But sometimes I would have to use one method, other times I'd have to use another method, depending on the subject. So just whatever it takes. Make realistic study schedules and stick to them. Like, how many times have you made a schedule and you just like don't stick to it at all? But that's probably because it wasn't realistic. So you need to make sure that it's realistic. Make sure you put in time for rest, you put in time for review, you put in a buffer so that way if you are behind, you have time to catch up. But make sure to try and stick to it. Lean on each other and hold each other accountable. So it's important to have people around you who also know what their why is and have similar goals to you and or have goals that they're working towards so that you can hold each other accountable. I can't tell you how many times I would want to go to, you know, a party or to a barbecue or do something fun. And one of my friends who now is an emergency medicine doctor in Jersey City would always be like, we don't have time for that. We need to go to the library. So get your books and let's go. And I'm so grateful for her holding me accountable. Focus on your own journey and don't compare yourself to other people's in negative ways or compete. We can all win. And this is something that is very common amongst pre-health students. We often feel like we're behind or this person is like doing better than me. It's not about that. That's why you have to remember your why and what you're doing it for. Because if you compare yourself to other people, then you're not focused on your own journey. You're worried about what everyone else is doing. And your endpoint is different than someone else's endpoint. So for instance, my classmates from college or from med school, they are doing something completely different. They didn't want to do adolescent medicine like me. So what they're doing has nothing to do with what I'm doing because we had different goals in the end. And then make sure you find your support system. And not just your support system as far as like your classmates or people that you study with, but mentorship. Mentorship is super important. And there's multiple, we'll talk about this in a few slides, but there's multiple levels of mentorship. There's multiple types of mentors. There's people who you have for a short time, for a long time, but making sure to find people who are doing what it is that you want to do or who aren't doing what it is you want to do, but are there to support you and push you is super important. And then know thyself. Develop your wellness toolbox because you are going to need it. There are going to be multiple times in your training and in your schooling that you're going to feel like you're off balance. What is it that brings you back to center? What is it that brings you back to your normal self? So for instance, for me, I know when things are off, when my apartment is a mess, when I don't have groceries, when my laundry needs to be done. Like for me, I know that those are like the basic necessities I need to do to feel like I'm back on center. Going to the gym, drinking water, feeding yourself with fruits and vegetables and things that are going to make you feel good. These are some things that some people use to get back to their self. And then also therapy. I'm going to say this and I'm going to say it again. Therapy is super important, especially if you're going into the health field. A lot of times in the health field, we're like, oh, I can do this. Like, I got this. Like, I don't need help. But you're going to see some really terrible things throughout the course of your training. You're going to see people who are very sick. You're going to see people die. You're going to see people, you know, things happen to people that are really, really hard. You're seeing people at their most vulnerable points. And carrying that burden for many, many years can take a toll on you. So it's important that you make also the time and the space for yourself. And therapy is one of the ways to do that. So I recommend therapy for anyone who's going into the healthcare field. So make sure you do that. So these are some pictures of all of my notes over the course of time. This is not all of them, but these are just some that I have pictures of. But as you can see, it never ends. So like we talked about with creating a study schedule, make sure that you identify all the information that you need to cover and how much time you have. So for instance, you have a midterm coming up. You have 5 chapters that you need to cover in that midterm, and you have 3 weeks to study. So you divide those 5 chapters by those 3 weeks and you distribute it across that time. And then look at your plan from multiple angles. What are you doing each day? What are you doing each week? What are you doing each month? And then vary the type of studying you're doing. Flashcards, reading, questions, whatever it is to kind of like round out your studying. Make sure to build in those wellness days and catch-up days, review your weaker areas, and make sure that the things that are just like rote memorization, you do closer to the exam. So a lot of times people will waste their energy trying to memorize things earlier in their study schedule, and it's just not going to stick because it's just straight memorization and you need to remember it closer to the exam. Realize that there are things you're going to miss, and you have to just like take that L, right? You got to be like, you know what? I'm never going to, me and the nephron just don't get along, and I'm going to study it as much as I can. But if I get a question wrong about the, sodium, potassium, whatever transporter, it is what it is. Like, I'm just going to have to take that L. And then move on and repeat. So don't get stuck on that exam or whatever quiz or whatever thing that kind of went wrong. You want to figure out kind of what your weaknesses were, but move on and try something different with your next exam. So this is a quick example. So for instance, 5 chapters, Monday through Friday, you're doing 1 chapter each. You're doing some practice questions. You're reviewing your notes from the prior day. And then Saturday, you're like, you know what? It's my rest day. Or if you did a really good job doing all the things you needed to do, then you have Saturday just to do some flashcards. But if you fell behind, then that's a day for you to catch up. And then Sunday is your day to rest. And it's important to incorporate the rest day so you can reset, like we talked about with getting back to your center, doing your laundry, getting your groceries, taking a walk, whatever it is you need to like recenter. And then when it comes to mentorship, like we talked about already, mentorship is a relationship with a more experienced person and a person who's interested in a similar field, or someone who has a similar skill set, and you work together to help the less experienced person accomplish their goals. A lot of times people don't understand that mentorship is a partnership. So while your mentor should be there to help you, you also need to help yourself, and you need to also reach out to your mentor, ask for what you need, have a plan, etc. Mentorship can evolve over time. I've had people who were my mentors when I was in college, and now they're not my mentors in that way anymore because I have moved on to a different part in my training or my whatever, where I don't need their help in that same way. And it can be bi-directional. A lot of times people learn from their mentees. And mentorship actually requires work. It's not something where you're just like, oh, you're my mentor, thank you. It actually requires you them reaching out to you, making time, etc. So mentorship involves, as a mentor, because many of you will become someone's mentor or are already mentoring people. And it's important to remember that no matter where you are in your training, there's always somebody below you or behind you that you can mentor. And many of you probably are already doing this. But make sure that you're ready for the commitment, know your limitations, discuss the expectations upfront, establish goals, reach out to the mentee often, respect each other's time and be present and listen, right? Like, don't be meeting up with the mentee, and you're sitting there on your phone or you're like doing other things. Ask questions and offer guidance, not criticism, and understand your limitations and help with connection. So if you're mentoring someone who's a high school student and they're interested in engineering, and you're like, you know what, I'm going into the healthcare field, I don't know anything about that, let me connect you with my friend who's in the engineering program. So, and then as a mentee, there's lots of things that you also need to do. Make sure you identify the goal of the mentorship. So what are you trying to get out of having this person be your mentor, right? Just because someone is senior or someone is well respected in a field does not mean that they make a good mentor, right? Just because they're doing exactly what it is you want to do does not mean that they are a good mentor. There's other things that are important in that person being your mentor, like we mentioned on the previous slide. So make sure that you have a goal, not just, oh, I want to like meet with you and have lunch. What are you trying to get out of this mentorship? Are they going to help you with your professional goals? Are they going to help you with research goals? Are they just someone who you're going to just, shoot the breeze with, and you just want to know more about their life and their experiences and what they've been through? What is it that you're trying to get? Prepare an agenda or topic to discuss at each meeting. So what I used to do is I would put my meeting on the person's calendar So that way they would have a reminder. I normally would set the meetings for 30 minutes because you don't want to assume that you have a full hour of someone's time. Sometimes they do have that, but 30 minutes is a good middle ground. If they have extra time, then you get the extra time. And then I would put in the notes what I wanted to discuss during that meeting so that they would know ahead of time. Want to review, I don't know, CV. I want to review my resume. I want to review my personal statement. That way you come to that meeting with a goal. Be open-minded and implement any tasks that you discuss. The worst thing as a mentor, the worst thing is when you give somebody advice or they ask you for advice or they ask you how to do something or what to do, you give them the advice and they don't do it. And then they come back to meet you again and they didn't do any of the things that you talked about. You feel like you wasted your time. So if you talked with your mentor about doing a certain thing, make sure that you implement those things that you agreed upon. Reach out often with updates, be present and be flexible. Because remember, mentors are also people. And so sometimes people have kids or they have a job and the clinic, went over and blah, blah, blah. So be understanding from that standpoint. Don't take things personal. Once again, people have lives. Sometimes people are going through divorces or breakups, or they might be sick. They might have other things going on that you don't know about. So don't take it personal if they cancel or they pull back and they can't be as involved. And then pay it forward and make sure that you're mentoring other people. And then during college, I continued on this trajectory of being involved in sexual health, and I created a sexual health curriculum for my public health practicum. So that was just keeping with the thread of you're remembering your why. Are there any questions about the mentorship piece? I know that I'm supposed to tell you about my story, but I think that it's super important that you guys take away some of these things. Okay, thank you. I'm glad you enjoyed that advice. Because I don't want to just talk about me for the whole time. I also want you all to get some practical tips for how to keep, move forward. All right, so I graduated college and then I was med school Tasha. And in med school, I kept along the same thread of remembering your why. And like I said, in undergrad, I created this curriculum. And then in med school, I actually took that curriculum, expanded it, did some further development of it, and started a group in a local high school, a sexual health education group at a high school. So this is me doing some teaching with the teenagers in the clinic. That's a great question about how to look for mentorships. So like I mentioned before, someone who's doing something similar to what it is that you want to do, but making sure that you have a goal for that meeting, right? So you say, for instance, for me, I'm in adolescent medicine. When I was a med student at NYU, and there was an adolescent medicine doctor who had started right during my, I think, 3rd year or 4th year of med school. And I cold emailed her and I was like, hi, I'm Tasha and I'm interested in adolescent medicine. Can we sit down to talk about what your career is like, what the trajectory is for that, et cetera. So that's one of the ways to identify mentors is someone who's doing what it is that you want to do, and it is already there or on the way there so that you can get the advice. And there's multiple levels, right? If you're going into medical training, someone who's a med student will offer you very different advice than someone who's an attending and the PI or the principal investigator on some research grant. They're just different. They have different life experiences, but they all have something to offer. So it's important to have that med student mentor because they're going to be the ones to be make sure you get this book. This book was the most helpful. Do these question banks, blah, blah, blah. But then that higher up mentor is going to be the one that's going to be have you heard about this program or this, research opportunity, or let me connect you with my colleague who does blah, blah, blah. So that's one way is just cold email people. And don't take it personal if they don't get back to you. They may take a while to get back to you. But if there's somebody who's in your field, in your school or at your institution that's doing something you're interested in, feel free to reach out to them. Mentorship in medicine is very much expected. Because we all got to where we are because someone mentored us. So getting through medical training without a mentor is impossible. We all have had mentors, and so we all are open to mentorship. So don't be afraid to cold email somebody who is doing something that you're interested in. And there's lots of mentorship programs similar to this program, but there's many mentorship programs within institutions, nationally, virtually. So there's many different ways to find mentors. But once again, it needs to be, you have to identify when you're finding that mentor, what am I getting from this? What in particular, what need is this person fitting or filling for me? So I have mentors who I turn to specifically for clinical questions. I have mentors who I turn to for research questions. I have mentors who I turn to for life questions, like how do I balance this and balance that? And then I have mentors who I turn to for my business endeavors. So picking those different categories of what it is that you're trying to do and finding mentors in each of those areas. And sometimes mentors fall into your lap. When I was in medical school, I was one of 6 Black people in my class. And I felt very isolated and very alone. And one of the attendings, she was also a Black woman. We were at some like event or mixer or something another. And she literally came to me and was like, I'm going to mentor you. And she was just like, I'm your mentor. That's it. And I was like, okay. Because at that point, I just felt so alone and didn't really know how to find a mentor at that institution. But she saw that I was there and she reached out to me. So sometimes mentorships happen that way too. So moving along, then I was peds residency, Tasha. This is me going back to my middle school and doing a talk about pediatrics with the kids. And I also, like I said, have an interest in reproductive health and global health. And so I took some of the curriculum that I started in college and implemented in medical school. And then I took it to Kenya and I revamped it for the population that I was working with in Kenya. And I was working specifically with parenting and pregnant teens at a teen clinic in Western Kenya. So that was an awesome experience and continued with my why I was going into medicine. And then I decided to do adolescent medicine fellowship. So many of you are probably wondering, like, what is adolescent medicine anyway, right? You probably haven't heard of it. The question is, how did you connect and build relationships in Kenya and in the global health sphere in general? It's a great question. So once again, the other thing I forgot to say, besides writing down what your goals are and what your why is, also telling people. So when people know that you're interested in something, opportunities come your way because people know that you're the person or you're interested in something. And when they hear about those opportunities, they send them your way. So for me, I had always been very interested in global health. I did an international health course when I was in college. And then when I went to medical school, many medical school programs have global health programs. And so I actually did my master's in public health and did a global master's in public health. And so that was how I kind of got more involved in the global health sphere. But there's lots and lots of programs throughout the country and throughout the world that you can join. So start with your institution. Most colleges have some form of global health or international work. Also, you can do like a study abroad, et cetera. So I would say start with your institution and look there. The project that I started working on in Kenya was through my pediatric residency program. So there's a program called AMPATH. And AMPATH is basically a partnership between a medical institution in Western Kenya and multiple institutions throughout the world, including the institution that I was at while I was in residency. So that's how I ended up in Kenya. But literally, the opportunity just like fell into my lap. Like they had started this partnership the year that I was supposed to be in the global health track of my residency program, and the opportunity just like came. So it just was serendipitous that way. But definitely, there are lots and lots of global health programs and opportunities throughout different institutions and throughout the world and the country. So you just have to find them. But as long as you talk about it and you let people know, people will send them your way. And a lot of them are paid for. So all of my travel was paid for through either the school I was at or the institution I was at the time. So definitely there are opportunities. So adolescent for young people ages 11 to 25. And so we do everything related to adolescent care, anything a teenager, young person would need, including primary care like vaccines and weights and heights and things like that, reproductive and sexual health, puberty, eating disorders, chronic illness, pain syndrome, substance use, school health, juvenile justice, sports medicine, global health, college health. So adolescent doctors take care of adolescents. And so I knew for me that that was what I wanted to do. And it fit along with my trajectory of my why. And I initially was very interested in health education, but as I went further in my training, I also realized that I wanted to do more than just teach. I also wanted to treat and care for adolescents and also be able to step in a room and say, I am the expert on this, and this is what we need to do for and advocate for teenagers and young people. So that was what leaned me towards medicine. And I knew if I was going to do medicine, that I was going to do adolescent medicine. So then fast forward again, and I started Gorjus Doc. So this is literally a sketch in my notepad on my phone. And then I actually painted this. And then I paid somebody to make it into a logo. So this is the evolution of Gorjus Doc. And I started Gorjus Doc as a blog to talk about my experiences as a Black woman in medicine. And there, is not a lot of diversity in medicine. Like I mentioned, I was one of 6 people in my class. So really it started out as a blog where I just talked about like my experiences being in medicine and my experiences with patients, et cetera. And as you could see through all of those other slides, I've always been interested in sexual health and reproductive health. And then the pandemic happened and I was like, okay, I don't want to blog about being, what I ate for lunch and the outfit that I'm wearing. I actually want to do something meaningful and impactful. And the pandemic really ripped everything wide open. And specifically for adolescents, there was a lot of discussion around COVID and getting COVID, but nobody was talking about all these other impacts that COVID had on teenagers, including on their development, on reproductive health care, mental health, et cetera. And so at that point, I decided, and I needed to reach these young people and make sure that young people knew that there were people who cared about these other things. And the best way to do that is through social media, because that's where young people are, and specifically Instagram and YouTube and Snapchat. This doesn't include TikTok because it was before 2020, but that's where teens are. So that's where we need to be. So I dedicated my organization to increasing access to sexual health education through social media, but also keeping that reproductive justice lens. And the reason why that's important is because sex ed in our country sucks. I know many of you probably know this from personal experience, and thinking about the sex ed that you got at your school and thinking back to the sex ed I got at my school, it wasn't great. And it varies by state. It depends on where you live. It depends on, many, many different factors as to what kind of education you receive. And even the places that have comprehensive sex ed programs, they still suck, right? And most programs are actually, most places in the country are providing abstinence only programs, which we know don't work. So there's lots of work that needs to be done. And when it comes to comprehensive sex ed, it focuses mostly on the negative things related to sex, like don't get pregnant, don't do this, don't do that. But it doesn't teach people the skills that they need to live a healthy sexual life, right? It just teaches you like, don't have sex because you'll get pregnant. And most of these curriculums are developed with the needs of white, hetero, cis normative, needs, not the needs of the queer, student who just recently immigrated here from another country. It's not comprehensive in that way. And it has impacts on people's health. So there's lots of work that needs to be done in the world of sexual health. So this is where reproductive justice comes in. And this is the human right to maintain bodily autonomy, have children, not have children, and parent those children in safe and sustainable communities. And this term was coined by Sister Song. And we have to remember where we came from in order to know why we're here now. And like I mentioned, sex ed initially was created under the guise of preventing diseases and undesirable pregnancy. It's very problem-centered language, and Black and brown and people of color and people who are who are unfit to reproduce are seen as problematic and as things that need to be fixed. And so this is the way that sexual health curriculums have been developed. And so we need to move away from that type of language. And racism and reproductive health is rampant, right? This is like a whole nother talk. We don't have time for that, but this is part of the reason why I'm so passionate about this, is because racism and reproductive health has been since the beginning of this country, since the inception of this country, with slavery, all throughout the Jim Crow era, during civil rights, and all the way up until current times. And it's happening right now. I haven't included this in this presentation because it just happened, but think about this whole Roe versus Wade situation. Think about the attacks on trans care and on trans youth throughout the country. It really is not something that has stopped. It's continuing to happen now. So this is why it's something that we should care about. So that being said, the combination of my interest in adolescent medicine, my interest in sexual reproductive health, my interest in reproductive justice, my skills and experience with writing and drawing and art, etc., I decided to start my own organization, and that's how Gorjus came about. So these are some of the images that I've drawn featuring people of color and different body shapes, skin tones, etc. Because when I was starting my organization, I quite frankly couldn't find it. And then this is me on the gram, doing Instagram lives, other conversations around important topics like menstrual justice and period poverty, and PEP and PrEP, etc. So at this point, I've branched out Gorjus to create Gorjus Sex Ed, and the purpose is so that people are not confused, because people are like, what is a Gorjus Like, what does that mean? But now people know that I'm a sexual health education organization. And we create content, images, all types of different materials for people who are working with young people, and specifically targeting young people so that they can make sure that the sexual health content that they're creating is medically accurate, relevant, inclusive, and culturally competent. So that's who I am. That's where I am. That's what I'm doing. This is my information. Feel free to check out my website. Feel free to follow me on the gram. I do have a TikTok, but I don't use it because I'm a millennial and I don't want to learn another platform. But at some point, I probably will be on TikTok. And yeah, if you're someone who's doing sexual health education work, feel free to reach out to me. I would love to collab. If you need images, let me know. And yeah, that's it. So just remember your why. I hope this was helpful, not only in understanding adolescent medicine and who I am, but also in thinking about your trajectory and what you want to do and who you want to be. But that's it. That's all I have. Any questions?
Awesome. So thank you so much for your presentation. So now we're at the part of our shadowing session where you guys can go ahead and put your questions in the chat.
As an adolescent health clinician, how do you navigate the line of privacy between patients and parents? Oh, great question. So first of all, you have to know the law. So in each state, there are different laws related to confidentiality for adolescents. In general, from a moral standpoint, adolescents should have the right to reproductive health and mental health confidentially. So that includes birth control, STI screening, and testing and treatments. And from a mental health standpoint, therapy for like depression, anxiety, etc. So that's from a morality standpoint, but from a practical standpoint, it varies by states. So as an adolescent health doctor, I need to know what the laws are in my state. I practiced in Washington, D.C. for 2 years. And in D.C., we also saw patients from Maryland and from Virginia, and the laws from state to state completely vary. So for the most part, I try my best to respect the privacy of the patient. I kick the parent out of the room every visit so that I can talk with the adolescent alone and elicit like what kind of concerns they may have, if there's any questions they may have. As an adolescent doctor, one of the main tools that we use for talking to adolescents is something called the HEADS assessment, which is basically a questionnaire where we ask a bunch of different questions related to like your home environment, school, drugs, sex, if you're suicidal or having any mental health issues, et cetera. So that's a normal part of what we do in our psychosocial assessment. But it is very difficult. And as much as possible, I try to bring the parents in so that it's a partnership. But in some cases, the parents can be part of the problem, and or talking with the parent can actually hinder the patient from getting whatever services they may want to get or things they might need. So we often have to be creative. So I'll say, okay, you want to start birth control? I'm going to have to send it to the pharmacy. The pharmacy is going to call your mom and tell your mom that there's a prescription there for birth control. So how do you want to go about this? So I might tell the parent, she's having really bad cramps. So I'm going to prescribe this birth control to help with her cramps. But me and the patient know that they're using it also to prevent pregnancy. So sometimes you just have to like kind of find a way to, navigate those situations. But for the most part, you try as best as you can to protect the patient. And sometimes protecting the patient is not telling the parent, but sometimes protecting the patient is telling the parent. So if someone's suicidal, if someone is being harmed by somebody, so I would tell my patients, everything we talk about is between you and I and the computer and my supervising doctor. But if you are going to hurt yourself, if you're going to hurt someone else, or if someone is hurting you, I have to break confidentiality. So that's how I navigate that. That was a long answer. Other questions? Do you listen to any podcasts related to your profession or for personal pleasure? If so, please suggest some. Unfortunately, I am not a podcast person because I know, once again, this is like identifying what type of learner you are. I'm more visual, as you can see, because I do all this drawing and stuff. So I don't really like podcasts. I just can't really, I feel like I should, but I don't. But I do follow a bunch of Instagram accounts that are related to sexual health. And I can't think of any off the top of my head, but if you follow me on Instagram and then go to some of the like organizations that I'm following, you'll see some like really good organizations. So like Teens Pack is like an organization in New York that works with young people, and they have a program for young people who are in college and high school. So if you're in the New York area and you're interested in reproductive health or sexual health, it's a great organization. LAYC, which is the Latin American Youth Center, is in DC. They do something very similar. So those are some of the organizations that I've worked with and that I follow, but I don't have a better answer. Okay. How do you prevent burnout as a student and provider? Great question. So that goes back to this slide. where to go? This one. So remembering your why is important in preventing burnout, because if something you're doing is not aligning with your why, you need to cut it out, right? If you're doing a research project and it's not related to your why, then you need to stop that research project and or finish it and move on, right? Of course, we're all going to do things that we need to do to get what we need to get, but it should always come back to your why. And if it's not something that's coming back to your why, then you need to not allocate as much time to it. And making sure to develop that toolbox as to like what helps you to get back to yourself and to identify that you're burnt out and do the things that you need to do to get back on center. That's really important. And then prioritizing. As a health, pre-health student or as a person in healthcare, you're going to feel like you have to do everything all the time, right? I have 10 tasks on my list. I have to finish all 10 of those tasks. Sometimes it's not possible. You have to prioritize and figure out what are the top 3 things I need to do today and what can wait until tomorrow. It's 8 o'clock. I'm no longer answering any more emails. I'm closing my laptop and I'm going to sit here. I'm going to watch TV. Like, you have to create those boundaries, prioritize, and then create those boundaries. And that's how you help to adjust to burnout. And then removing yourself from environments that you don't feel serve you. If you're at a school or at a program or at an institution or at a job that just is not feeding your soul, like, you might just have to leave. And in medical training, that could be hard, but it's not impossible. So change your environment if you have to. And cut out the people in your life that are toxic and don't support you. So you seem to be interested in reproductive health. Did you at all at any point consider a field in OBGYN? Yes, I did. I was on the fence. I forgot to mention this. I was on the fence between OBGYN and pediatrics. I knew that I wanted to work with teenagers. The thing that kind of differentiated it for me was that I was not interested in surgery. I'm interested in doing procedures, which I do as an adolescent doctor. I put in Nexplanons, I put in IUDs. So I get to do reproductive health procedures, but I did not want to be standing in the OR for 8 hours doing a gyne oncology case. That just like felt like the worst thing in the world to me. And then I also thought about long-term, like, what do I want? What do I envision for myself? Like, as like a practicing physician. And the thought of me being woken up out of my bed to go and deliver someone's baby made me want to cringe. So I was like, I can't do OBGYN. So all the parts of OBGYN that I love, which are the reproductive health counseling, the reproductive health, sexual health, STI testing, contraceptive counseling, all that stuff are still prominent in adolescent medicine. And so that's kind of how I decided. I knew I wanted to work with teens. I knew I wanted to do reproductive health. And I was like, basically, what's the path of least resistance to get there? And adolescent medicine was that path. So, and I literally took a piece of paper and wrote down like what I wanted in my career. And I think it's on Instagram because I found it and I was like, oh, this is exactly what I'm doing right now. But I didn't want a job where I felt unhappy. I wanted to feel happy. I wanted balance. I want to be able to travel. I want to be able to come home and like relax and not have to worry about being called in or being on call or anything like that. So that was how I ruled out OBGYN. If they had a women's health specialty that didn't require me to go to the OR or require me to be called in to deliver babies, I might do that. But at OBGYN as it is now just wasn't a good fit for me. As a first generation college student, how did you deal with the pressure and fear of failure? I deal with the pressure and fear of failure every day. It doesn't go away. But yeah, it's a huge pressure. And it honestly, I haven't really felt fully like competent or fully confident in like my ability or as a doctor until I like got here to this point. So in every part of my training and every part, like step as you go, the imposter syndrome is real. And there's times where I would be like, am I supposed to be here? Did they make a mistake? Like, like maybe one time I remember like my name wasn't like on some list with all the med students on it. And I was like, see, there it is. Like, I'm not supposed to be here. I got here in an accident. Like my name's not on the list because I'm not actually enrolled here. Like, so the imposter syndrome is real. But I think remembering your why, and I know I sound super cheesy saying this, but remembering your why keeps you focused, right? for me, I was like, I can't stop. I can't fail because people need me. Teenagers, young people, people all over the world who I'm trying to help need me. I cannot quit right now. I can't stop because if I don't do it, who's going to do it? I have to do it. I have to be a part of the solution to this problem, to this I had to fulfill my why. So that's why understanding your why is super important. And even though there's going to be pressure, there's definitely going to be failures. You're going to fail a test. You're going to maybe not get into the school that you want to get into. You may not get an interview at the school you want to get into. There's going to be multiple points of failure. But it's about getting up, dusting yourself off, and doing whatever it takes to get to your endpoint. And that's why understanding and remember your why is super important. Which areas in adolescent health require the most work for clinicians and researchers, in your opinion? Yes. So the bane of everyone's existence in adolescent health is eating disorders. So no one in adolescent medicine, I shouldn't say no one, most people in adolescent medicine do not like managing eating disorders because it is a very terrible disease. Eating disorders are much more common now. With the pandemic, we've definitely seen rises in the numbers. And with eating disorders, the issue is not only is it a medical problem, but it's also a mental health disorder. And so it requires lots of work to help someone recover from their eating disorder, and lots of specialized training and specialized resources that are actually in a shortage throughout the country. So eating disorders are very difficult to manage. And because it is a psychiatric disorder, there are people who really, really struggle with their eating disorder. And there are times where you have to restrain them in order to give them their nutrition. And it can be really, really emotionally taxing. So I think in adolescent health, that's probably the most difficult area of work. And a lot of people have tried, some adolescent doctors specifically focus on eating disorders, and other adolescent doctors have kind of tried to avoid it or not be involved with it if they can. But we're at a juncture now where you can't avoid it. And it touches everyone. Back in the day, they used to think that eating disorders only affected white girls, but eating disorders affect all races, all genders. People who are LGBTQ plus are also impacted by eating disorders. Black girls, Black boys, Indian, transgender youth, everyone is impacted. So at this point, it's not something that you can ignore. So yeah, that's the thing. What's one of the best books you would recommend? So I have a couple of books that I've read during medical school that were really helpful. Probably the most helpful was Medical Apartheid. And Medical Apartheid is a book that talks about talks about the racism in medicine, and gives specific examples of the injustices that have happened throughout history. I find that it's unfortunate, but medical training is inherently racist. You're going to learn things in your medical training that are incorrect and are not culturally appropriate or culturally sensitive. And many institutions are trying to change that and fix that and improve that. But we have to remember that medical systems are inherently racist. That changes and things that we've seen, and advancements we've seen in medicine have been on the backs of people of color. People of color have not had access to medical services in the past history and still continue to have barriers. There's medical mistrust. There's a lack of people who are from diverse backgrounds in medicine. There's multiple areas in which medicine is a hot mess. So Medical Apartheid I found to be very helpful and kind of grounding and setting the stage for me to understand that while I was in my medical training, what I was learning was correct, but also, from a scientific standpoint, but from a social justice, reproductive justice, helping the world standpoint, there's many gaps. So I would recommend reading that book. And whether you're interested in anti-racism work or not, if you're going into the healthcare field, you need to be aware of these things. So I would recommend that book, highly recommend it. Yes. If no podcast, I suggest, or any books, or even other docs on social media that I love. Yes. Off the top of my head, the period doc, she does a lot of work with period equity. There's another person called With Love, Dr. Shimmy. She is also a period advocate and doctor. I'm trying to think of who else. I mean, there's so many people. Dr. Hina Tlaib, she is an adolescent medicine doctor who does a lot of adolescent like advocacy. There's, I think her name is Jen Gunter. Oh, yes, Dr. Jen Gunter. She wrote a book called The Vagina Bible, and she talks a lot about like medical misinformation related to reproductive health. And then there's Dr. Jennifer Lincoln. She's an OBGYN who also talks about a lot about reproductive health. There's a podcast. Oh, I do listen to one podcast. There's Sex Ed with Sex Ed with DB, I believe it is. Yes, Sex Ed with DB podcast. So she talks about sexual health and has like multiple people that she interviews on her podcast. And I actually did one of her interviews. And then Sex Ed with Irma. She's a sex educator in Texas. So her work is really good. I'm trying to think of who else. I have so many sex ed friends, y'all. I'm trying to think if there's anybody else. I think those are the main people I can know off the top of my head. But yeah, there's a lot of people on social media doing really amazing work. And it's just really cool to see. Yeah, I think those are the ones I know off the top of my head. I hope you guys were able to get those all. Okay, any other questions? Thanks for the questions. And, you know, if you're interested in adolescent medicine and you want to know more, just reach out. I should have included as well the adolescent medicine website. So that website, the governing body website, I think is, I believe this is the website. Let me just confirm. And this website has more information. Yes, adolescenthealth.org. This website has more information about a career in adolescent medicine. And you don't have to be a doctor to do adolescent health. You can also be a nurse practitioner. You can be an RN. You can be a mental health provider. So adolescent medicine is beyond just being a doctor. There's other people who are part of the team.
Awesome, thank you so much. So now we're going to go ahead and share the wrap-up slides. All right, so let's go ahead and reflect what brought you guys to this session today and what are 3 major takeaways from this presentation and what do you want to learn more about? Go ahead and put that in the chat. And once again, if you would like more recognition, you can go ahead and submit your articles, reflections, reviews, success stories, and more into our freehealthshadowing.com/blog submissions. And we do have opportunities and we're always looking for student volunteers as well as currently team members. So you go ahead and apply on our website. The links are over here and I believe they're also in the chat somewhere earlier. And once again, we are a program that is free and accessible to everyone, and we run solely off of the time and donations of our volunteers. So we would deeply appreciate if you can donate to us. Here's a QR code. And now that we are at the end of our shadowing session, you can go ahead and go to our pre-health shadowing website, view the professionals course page, sign up and for the free course, and go ahead and answer the questions in order to get your certificate. It's a simple 10-question multiple choice based on the presentation, and you have 2 chances, and you need to get at least a 70% or higher for verification of your virtual shadowing hours. Quizzes are open indefinitely for your convenience. And if you missed any part of the session, you can go ahead and go to our YouTube channel or visit at Pre-Health Shadowing to watch any of the sessions we've had, including the ones in the past. And be sure to catch up on our sessions every week. It's on our website. You can also go ahead and sign up to be in our email list so you never have to miss any of our sessions. See you guys next time. Thank you so much for joining. If you have any questions, feel free to stick around, and yeah.
Hi, Dr. Ramsey. I just wanted to say thank you so much for joining us today. It was an absolute pleasure to host you in our program and to hear all the amazing insight that you were able to provide. So thank you.
Of course, not a problem. Thanks for having me.
Of course.
I hope I covered everything and didn't go too much.
No, I think it was wonderful, and I'm glad we had some questions in the chat as well. I know that I didn't get to introduce myself at the beginning, but my name is Nina. I'm the one who's been in contact with you, and I'm a third-year undergraduate student. I am studying biopsychology with an interest in going into medicine and business, so potentially doing a joint degree. And yeah, I'm also the founder and CEO of Pre-Health Shadowing. So once again, I appreciate everything you're doing to support the next generation of healthcare professionals like myself. And if you have any questions about anything or want to follow up, maybe do some collaborations in the future, we'd be happy to do that.
Yeah, that'll be great. You should look at NYU because they have a really good MD MBA program.
Oh, really? Okay.
Yeah, so a lot of schools have MD MBA programs, so you can do both within like 5 years or 6 years.
That's awesome. I'll check that out. Yeah, I'm starting to look at the different programs and starting to make my list because I'm thinking about doing a gap year too. So
Okay.
trying to get those together and kind of see what I need to see the marks that I need to hit.